So this is the third concept I created, the Chic Lift. It's a C shape around the eyes to hide this indentation, to hide that there is a long distance between the lower eyelid and the eyelashes to the mid-face projection because of the sagging of the fat pad, mid-fat pad, and atrophy. And the orbicularis muscle look very loose and sagging, and after half a cc here, that time I was using a cannula, you see I reduce the distance of the projection to the eyelashes and create the illusion that the auricularis muscle is stronger and higher and shorter. Well, and this is just half a cc per side. If you use mid-face and tear trough and temple and eyebrow, we'll see the concept that creates a C shape around the eyes. That's why I call it the Chic Lift. And on all the top models, you can see this C shape with 3 parallel lines from the upper eyelid to the sulcus of the upper eyelid and roughly to the eyebrows. And then you have this smooth eyebrow junction. So we need to inject a little bit the temple to create an arrow lift. We'll see this to lift the tail of the eyebrow, and then the lid cheek junction here. So how to do it? Let's start with the mid-face. The safe zone is medially. I created this safe triangle. You go 1 centimeter from the orbital rim down to the bone. There is no problem here, not the infraorbital nerve. It's more medial here. You can use the cannula. Then if you use a needle, you feel really where you are. You don't need to touch the bone. You know you are deep enough. And this is, I think that was XXL on this presentation. So you can use 0.5 up to 0.8 up to 1 ml per area. And then this is how to correct indirectly the tear trough by recreating the projection of the mid-face. From the same entry points, I create the volume. And then you can also go laterally on the malar bone, down to the bone, and then on the zygomatic bone to recreate an oval shape to create the illusion, and you see here the skull, that we had a new OG curve. And thanks, Lucas, to mention that. OG curve is a projection here and a lazy S to the face. And you see the great ovoid shape, the shadow here, this is immediately after. And by the way, this is also after the chin and the jawline injection. This is a younger lady with she's beautiful. She's a model, and we injected just half a cc of XL to go from a concave mid-face, very sad, to a convex mid-face with the shorter lower eyelid. I mean, the lower eyelid is the same, but create the illusion playing with light and shadow that it's shorter. Temple, I like to make it simple, creating a safe zone, lateral part of the orbit, zygoma, lateral part of the orbit, that's my anterior zone, then the zygoma, lower zone, then the linea temporalis, that's the malar bone. The linea temporalis is the temporal crest, and that defines the whole temporal area. Don't lose product to inject posteriorly. You will have no result at all because it's a huge muscle. You need more than 10 cc to fill that temporal area. And it's safe to stay close to the bone here, to the lateral part of the orbit, because if you inject deep here, you can be in the ischial fat pad, but also on the deep temporal artery. So that's why it's very important to stay 1 centimeter from the orbital rim and to keep that area safe. You never have the superficial temporal artery, neither the facial nerve. Okay, and here is the injection. So this is if you want to inject deep. So that's XL. You can also use L. It's a good product for this area. And then, or adjusted bolus, like the gunshot technique. But you see, like I like to do the oblique, like 30 degrees technique, and then you can also inject a little bit horizontal from the same entry point deep on the muscle. So I cover my injection with the deep temporalis fascia of the temporalis muscle, and it's 100% safe. If you want to inject a little bit more superficial, you can also use a cannula and spread the product or under the skin or under the superficial temporalis area. The problem is you create it like a cake and then the patient feel it because there is no fat and nothing between the superficial temporal fat fascia and the deep temporal fascia. And the concept of the eyebrow, and Lucas, you mentioned it, look at this beautiful top model. You have a light projection and a shadow, and that creates a beautiful eyes, slanting eyes. And that had a shape as an arrow, not as a sausage, as we do sometimes when we blow too much on the eyebrow. And this is one of my first cases 15 years ago in Monaco. And the cadaver dissection injection is done on the top of the bone under the orbicularis to recreate the tail of the eyebrow and the roof, the retroorbicularis oculi fat pad. And this is where to inject the product. Very safe, no arteries, nothing, no nerves, combined with the injection on the temple sometimes. And this is the video. You have to follow the orbital rim like half centimeter higher, and then you create a horizontal branch. Here I do it with the needle, but I will show you with a cannula. I use S or sometimes L, and then you create the tip of your arrow, and you do something a little bit oblique right here. So that creates the shape of your new eyebrow. And this is done with a cannula. So you start from the same entry point, you draw a line from the nostril to the lateral canthus to the tail of the eyebrow, and then you follow the orbital rim like 3 to 4 millimeters higher, and then you create an arrow. The tip is here, and then the triangle is posterior. And that's really nice because that creates the illusion that you have something, the eyebrow is slanting. It's also possible on difficult cases like this, on the Asian face. And this is a before and after. Look at the light projection. This is before, and this is after. Look at the light projection and the shadow created here. Wow. So where is dangerous? Medially. Never go on the supraorbital rim projection and a pedicle and supratrochlear. And this is also medially to the nose, no-go zone, of course. If you draw a line from the infraorbital nerve and supraorbital nerve, right here, it's a no-go zone. Where is it safe? The safe triangle, laterally, and on the mid-face. Also, safe arrow, safe triangle on the eyebrow, and this rectangle on the temple. So those zones are safe, deep down to the bone, of course, but also superficially can inject everywhere intradermal. Conclusion, the take-home message for this light and shadow, we don't have to overcorrect, don't volumize, don't talk about volume. What we want is to create projection and good contour. So for the sharp sculpture, I love the stylish XXL, chin, gonion, also the nose, the projection of the nose, the malar area, but laterally here on the zygoma. For the projection, which is like mid-face, horizontal branch of the mandible, or the nose when you don't want to over project, you use stylish XL. For contouring, like temple or cheeks, it's good to use L. And then for soft modeling, like eyebrow or tear trough, or fine lines, of course, you use stylish L, S. So the eyebrow, mid-face, and nose and jawline, you can make them safely and change the light and shadow. I'm sorry I didn't talk about the lips because in 30 minutes it's difficult. And then we focus on this message. So thank you guys, and this is my contribution. I invite you to go to the Vivacy platform and to ask questions. Thank you.